Before we get started, we will review some housekeeping items here. Okay, so tonight's session is being recorded for educational purposes. If you are interested in viewing the recording, it will be available on the Blum Center website. Please note that you are in listen-only mode. Everyone's cameras and mics are disabled so that we can see and hear our guest speaker. If you have any questions for our guest speaker, please enter them in the chat. And please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, after the session, please take a moment to complete the survey, which will be provided in the chat. Your feedback is important to us as we plan for future programs. So now we're going to introduce our speaker. Dr. Romit Bhattacharya is a general and preventive cardiologist, heart doctor at the Massachusetts General Hospital. He is also an instructor in medicine at Harvard Medical School. He is an affiliated researcher at the Broad Institute of Harvard and MIT, and the Associate Director of the Cardiac Lifestyle Program at Mass General. Dr. Bhattacharya research focuses on comprehensive cardiometabolic risk profiling using a combination of genomic risk and lifestyle risk factors. He also studies novel digital technologies as tools to characterize lifestyle behaviors and to help patients manage disease and health-promoting behaviors at home. Dr. Romit joins us tonight to give a talk on heart health. Please join us in welcoming Dr. Romit Bhattacharya.
Fantastic. Thank you so much, Luz. Do you mind unsharing your screen so I can share mine?
Yes.
Fantastic. All right. So you guys should now be seeing something that says how lifestyle changes improve heart health. Is that correct? Everyone seeing that? All right, everybody. So thank you so much for joining us this evening. This is a really important topic and something that's very near and dear to my heart, so to speak, in that, we know that heart disease is very responsive to lifestyle changes. As Luz kindly introduced me, I'm a preventive cardiologist. I'm a researcher as well. And the reason why I also do research is because I was seeing so many patients who come into the hospital with their first heart attack or heart failure episode or arrhythmia who ask me why. Hey, doc, how could this have happened to me? I tried to take care of myself. I tried to do the right things. How could this have happened? And I realized that there's a lot of things that we don't yet know about heart disease, but there's a lot that we do know, and the message just hasn't really gotten out. So I love doing this kind of seminar because I think it really helps us understand the importance of lifestyle changes and how they can improve heart health. Also, like while you're here, if I'll try and monitor the chat as well, but just in the chat, just leave a message for me about what brought you here and what you're hoping to learn today in our seminar. So when we start with thinking about cardiovascular disease, very often the second half of that word gets sort of left out. We think about the heart, but we don't think about all the hundreds of thousands of miles of blood vessels that exist in our body. So the cardiovascular disease includes the one heart that we have and all of the blood vessels that feed blood, nutrients, oxygen to all the organs of the body. And that's really important because the vessels are really the ones that get diseased in most of cardiovascular disease. And that's why cardiovascular disease co-occurs with things like dementia or stroke or chronic kidney disease or lung disease or numerous other diseases, peripheral arterial disease, even erectile dysfunction. All of that has to do with the diseases of the arteries that feed the different organs of the body. So I like to say that while we get pigeonholed as cardiologists into being described as just heart doctors, we're full body doctors. We think about the whole body. And then a new term has recently been cropping up, and some of you might have heard this, cardiometabolic disease, interestingly. So that's an entirely new term that has been evolving over the last, I'd say, 10 years or so. And that involves not just the heart, but also the kidneys, the pancreas. Pancreas is involved in diabetes and insulin resistance, as well as the liver. You may have heard of fatty liver disease. And why do these things get grouped together? Well, it's because they have the same underlying risk factors. We know that a poor diet, sedentary behavior, toxins like cigarettes, these things underlie a risk of all these different diseases. And we wonder, how does that really accumulate? Well, we can first start by just putting ourselves on the same page and understanding the same vocabulary. When we think about heart disease, we are often describing the disease of atherosclerosis. Atherosclerosis is the buildup of plaque in the arteries. And when we say plaque, what we mean is these cholesterol deposits that begin as tiny little deposits in the arteries, but can grow to be quite thick and begin to even obstruct the blood flow through the artery. So here you see in a normal artery, it's like a clean hose pipe. Beautiful blood flow will flow through that. But sometimes in a diseased artery where it's filled with plaque, that plaque can block the blood flow through the arteries. Now, the smaller the artery, the more likely it is to get affected. And so by the time that disease gets to the biggest arteries that we can see it, or it blocks blood flow to a major part of the heart, we know that the microscopic arteries are also affected. So atherosclerosis is the thing that really links all of these diseases together. So then we might ask ourselves, how does a healthy lifestyle improve heart health? Well, going back to atherosclerosis, this is now a more detailed view of the same process of atherosclerosis. But going back to it, here in the normal healthy artery, you're now seeing that the artery contains muscle wall, and then it also contains these cells on the inside that line it called the endothelium. That endothelium is incredibly important. I mean, people have won the Nobel Prize for describing the properties of the endothelium. And the endothelium, you can see here, when it's healthy, it's kind of all linked together, almost like a suit of armor, protecting the inner wall of the artery. But as risk factors accumulate, things like high blood pressure, which can damage the endothelial wall, things like smoking that can certainly damage the endothelial wall, um, things like high cholesterol that can damage the endothelial wall begins to tear up these little tiles. And much like, the highway that gets damaged during the winter snow and then the freeze and the ice and then the snow plows go over it, it starts digging up the walls of the endothelium. And that damaged endothelium is where all of this plaque can get into the wall of the artery. So that's lipids, calcium, cellular debris. It's all this like gunky cholesterol plaque. Well, after the plaque gets in there, then your body says, wait a minute, you're not supposed to be in there. And it starts engaging your body's immune response. And it says, okay, let's send our soldiers after that foreign invader that shouldn't be in the wall of the artery. And it starts sending the immune cells in after the cholesterol plaque. Those immune cells, now they're trying to kill the cholesterol. Little do they know, cholesterol isn't a living thing, but they're trying to kill it with secreting all of these damaging enzymes. And instead, what they end up doing is further damaging the endothelium. So this becomes a vicious cycle. So, in other words, to progress, for atherosclerosis, for heart disease to progress, you need two major things to happen. You need excess cholesterol. So this is someone's blood who has very high triglycerides. And you can see that the fat accumulation inside the blood is really scary, right? So you need excess fat, excess cholesterol in your blood, and you need an abnormal inflammatory response. So you need your body's inflammatory response, that's the immune activation to be abnormal. So when we talk about high cholesterol, so we're just going to zoom in on cholesterol for just a moment. When we talk about high cholesterol, one of the things that people don't realize is that, like most people have higher cholesterol than they biologically need, meaning more than our ancestors used to have, right? So when we look at about by 2035, the projection is that by 2035, about 45% of the US population will have high cholesterol as defined by our current medical system, right? But the issue is that our current medical system defines the high cholesterol being high as if it's like above the American average generally. Now, we started measuring the American average cholesterol in about the 1970s or so, when we started learning a lot about heart disease, and we learned that cholesterol was a major cause of heart disease. Problem is that by 1970, Americans already had really bad heart disease levels. The average American was developing heart disease. So then, how do we compare it? Well, in fact, we know that the numbers that we currently are using are not very good because, from 2015 to 2018, the average total cholesterol in the US for adults was around 191 milligrams per deciliter. Now, if people who were just above that number, if they were the only ones at risk, then you would expect that 95, 100% of all the heart attacks in the country would be happening in those people. But that's not what we see. Only 11.5% of adults had a total cholesterol above 240 milligrams per deciliter, and those with the highest 10% of cholesterol levels accounted for only 20% of heart attacks. So, interesting. Why is it that 80% of heart attacks are happening in people with more quote unquote normal cholesterols? Well, what we can do is we can look at other groups who are better reflect what we biologically need. So, for instance, we can look at hunter-gatherer humans who exist today. They just live in small communities and they don't go shopping at the grocery store. We can look at wild primates and we can look at other wild mammals, all of whom process cholesterol similarly to us. And while the adult American in 2004 had an average total cholesterol of around 210, we can see that hunter-gatherer humans, they have an average total cholesterol of around 110, half that. Even the Inuit who eat, they do tend to have a lot more fat in their diet. Sea mammals and like seals and whales, they tend to have total cholesterol levels around 130 to 140. When we look at other wild primates, again, the average hovers around 110. When we look at other wild mammals, again, the average hovers around 90 or even less. So how is it that we have so much cholesterol in our body? Well, you might say, hey, Romit, I know the answer. It's because cholesterol is needed to make our brains and our spinal cords, and we have such huge brains. So certainly, if you looked at a human fetus, you would see that their cholesterol must be higher than these other animals. And we'd say, no, that's not true. If we looked at human fetus at age 40 weeks gestation, we see that their LDL, now this is the bad cholesterol level, their LDL cholesterol is between 10 and 50 milligrams per deciliter. Really impressive. Really, really impressive. So basically, what we're learning is that biologically normal cholesterol is probably between 70 and 140 milligrams per deciliter. And biologically normal LDL cholesterol, your quote unquote bad cholesterol, some people call it, is 35 to 70 milligrams per deciliter. Whereas the American averages are far higher than that, basically double to 3 times as high. So, what can we do about this? Well, we're finally getting to lifestyle here, about 13 minutes into the session, but lifestyle is an incredibly important factor in managing all of your risk. When we look at so the American Heart Association has done a beautiful job looking at, millions and millions of Americans and saying, gosh, like what are the things that protect them from developing heart disease? What are the things that really matter when you look at the data? Well, it used to be they used to call it life's simple seven. They used to say there's 7 factors that when people do a good job of managing these factors, they don't go on to develop heart disease. In fact, they had to expand it a couple of years ago to life's essential 8 because one big risk factor they were overlooking was healthy sleep. Whew, that was so important, and the data became so obvious that they had to add it in, and they had to expand life's simple 7 to life's essential 8. So now we have eight factors that when they are optimized, our risk of developing heart disease plummets tremendously. This is great news. All the everybody these days is trying to hack their health. They're trying to learn some quick trick to figuring out, oh, I'm going to get healthier. This is it. This is the data-driven approach to hacking your health, right? And when we look at that, the first factor is what we put in our bodies. Eating a healthy diet, that is plant forward, that is filled with lean protein, has lots of whole foods and less processed foods, that's number one, right? Eating a healthy diet. The best dietary advice I ever heard was from the New York Times critic Mark Bittman, who used to say, "Eat food," meaning not plastic processed stuff. So eat food, mostly plants, not too much. That's it. That is probably the best dietary advice that you can get. Eat food, mostly plants, not too much. Right. So healthy diet is number one. Number two is being more active. So I'm gonna draw two distinctions here. One is getting enough physical activity. That means exercising enough to meet the national guidelines. The other, though, is actually avoiding sedentary activity. So I'll let you guys think over this question. I know you guys are muted and cameras off, so I can't ask you directly. But let's say you had two marathon runners, right? They're both very active, but one of them comes home and sits on the couch and watches TV all day, and the other one comes home and plays with kids and does gardening and walks to the store and things like that. Which one do you think is going to have a lower risk of heart disease in the future? Right? The one who's also moving around during the rest of his day, right? So you can get as much exercise as you want, but avoiding sedentary behavior or avoiding sitting all the time, that's also really important. Number three is quitting tobacco. Not smoking or quitting smoking is one of the most powerful things you can do for your health. Most people know that by now, so I'm not going to belabor it. Getting healthy sleep is one that people, I think, we often underestimate. And we think that this might have an underlying risk for lots of other things like liver disease, like cancer, like lung disease, like dementia. But sleep is such an important restorative aspect of our health. What we're realizing is that it also affects our immune system. And our immune system, as we learned before, is intimately tied in with heart disease risk. So when you get a nice, good, deep sleep for 7 to 9 hours, 7 to 9 hours, when you get that kind of sleep at night and it's restorative, it resets your immune system, it lowers your levels of inflammation, and we are able to see decreased inflammatory stress on the arteries in the heart. So that's just one mechanism. I'm sure there's hundreds of undiscovered mechanisms where sleep benefits you, but that's just one. And we'll talk about some of these in more detail. I have some slides on all of these things. And then, so the first four are things that I would consider have always been sort of in the patient's domain. Doctors don't tend to really get involved with patients' eating or activity or sleep or maybe smoking, but the last four are ones that typically doctors have gotten involved in, but it's so much better managed by you because this is your life and there's so many different things that you could be doing to manage your health. So numbers 5 through 8 are manage a healthy weight, control your cholesterol, maintain a healthy blood sugar, and managing your blood pressure. I'm just going to take a quick check in on the chat to see if people are dropping things that they're interested in. Nothing yet. Okay. All right. So this is usually an activity that I go through with some of my patients in our cardiac lifestyle program, where we do a 12-week session learning about lifestyle risk factors and how to manage heart disease risk. And we say, okay, if we had life's essential 8 over here, and we wanted to say what the mechanism is, not getting too sciencey, but just thinking a little bit about like how does it benefit our health? Does it help us control cholesterol? Does it help us keep our endothelium healthy? Or is it through some other mechanism like inflammation or something else? Right? And I have them bucket all of the essential 8 into these different categories. Okay? So starting us off just with not smoking, I tend to put not smoking in the healthy endothelium category and the inflammation bucket because we know that smoking triggers a really terrible cascade of events. It damages your endothelium, yes, but it also kicks off a horrible immune response that ultimately leads to increased cancers as well as increased cardiovascular disease risk. Managing your blood sugar. Managing your blood sugar is absolutely healthy endothelium, and a little indirectly, it can help you control cholesterol. Because when you have a big sugar load, it actually spikes your insulin, which also signals your liver to make a lot more cholesterol. And often the things that come in with that big sugar load are saturated fat and other things that lead to high cholesterol. Managing your blood pressure. Managing your blood pressure certainly affects your endothelial health, among other things. Controlling your cholesterol helps you control your cholesterol. Physical activity is absolutely a threefer. It helps you control your cholesterol, it improves your endothelial health, and it also lowers your inflammation. And then healthy diet is all three, absolutely. A healthy diet is the foundation of controlling your cholesterol. It also, when you eat, nutrient-rich, antioxidant-rich plant foods, eating the rainbow, all those different colors, man, that has an incredible effect on your healthy endothelium and on your inflammatory activity. When you eat whole grains and high fiber foods, that improves your gut bacteria, lowers your inflammatory burden. Lots of things are happening at that point. And then when you manage your weight, we're realizing that that is extremely important for both cholesterol management and inflammation. And we talk about sleep. Sleep is absolutely a threefer as well. It improves everything. So when we think back to the Life's Essential 8, we're going to go through a couple of these. Obviously, we don't have enough time to go through everything in a lot of detail, but I have a lot of slides here. I'll go through a bunch, and then I'll look to the chat for what questions we have, and I'll like to sort of spend some time answering some of those questions at the back end. So as we go through Life Essentially, the first thing that I want to talk about is I want to talk about this study. Now, I'm not going to give you a lot of hardcore science here or a lot of hardcore epidemiology, but there's this one study that I think we really need to talk about. It's called the Interheart study. The Interheart study was completed between the late 90s and the early 2000s, and it was done in 52 countries around the globe. 30,000 people they studied, and they looked at the question that they were asking was, across the globe, are the same risk factors responsible for heart disease? And they said, what if we looked at people who've never had a heart attack? And we said, okay, we're going to follow them for years, and we're going to see what were the most powerful factors, or if they had these types of risk factors, how much did that increase or decrease their risk of having a heart attack? And the numbers alone will really stun you because you're probably used to people telling you, oh, you should eat better, oh, you should exercise. But the numbers, when you look at the effect of these things, that's what's going to stun you. So I love to show this. So the risk factors they looked at both bad risk factors and good risk factors. Bad risk factors were smoking, diabetes, high blood pressure, high cholesterol, obesity, and psychosocial stress. And the good risk factors they looked at was no smoking, eating adequate fruits and vegetables, getting enough exercise, and having less alcohol. So the way we read this chart is that on the left here, we have negative risk factors, and on the right, we have positive risk factors. So for instance, if you smoke across the globe, your risk of developing a heart attack if you were a smoker was about 3 times higher, 2.9 times higher than everybody else. If you didn't smoke, if you didn't do anything else, but you did have diabetes, your risk was about 2.5 times higher, also known as 240% of the risk, right? If you didn't have diabetes, didn't smoke, but you did have high blood pressure, your risk was about 2 times higher of having a heart attack, 1.9, right? Now, if you didn't have any of those things, but you did have high cholesterol, your risk was 3.3 times higher. Wow. So that's high cholesterol was even higher risk than smoking in this group. But what happens when you start putting these risk factors together? If you're a smoker who's diabetic with high blood pressure, your risk is now 13 times higher, also known as 1,300%, 1,300% higher, right? Wow. If on top of that, you're a smoker who has diabetes with hypertension and bad cholesterol, now your risk is 42 times higher of having a heart attack. If on top of that, you're overweight or obese, you have a 68 times higher risk of having a heart attack. And if on top of that, you have psychosocial stress going on, you're now 183 times higher to have a heart attack. And if you have all of these, smoking, diabetes, high blood pressure, cholesterol, obesity, and psychosocial stress, boom, you're 333 times higher likelihood to have a heart attack. Wow. Now that is impressive. Well, what about the opposite? Well, in the opposite direction, they said that people's risk was at baseline 1.0, and so you can never get down to zero risk. So that's never going to happen, right? So the lowest you can possibly get is 0.0001, right? But nobody has that kind of low risk. So let's just set our sights here. And the most you could ever reduce your risk would be 100%, but no one can do that. So you're not going to see 333% here, right? So if you just didn't smoke, your risk came down about 65% compared to smokers. If maybe you were a smoker, maybe you weren't a smoker, didn't matter, but you just had adequate fruits and vegetables in your diet, you were able to drop your risk 30%. If you just had adequate exercise, which in this study was a very, very minimal threshold, dropped your risk 14%. And alcohol wasn't effective on its own at dropping your risk. But if you were a non-smoker who ate adequate fruits and vegetables, your risk was down 76%, right? If you were now a non-smoker who ate adequate fruits and vegetables and exercised, you've now cut out 79% of your risk of developing heart disease. And on top of that, if you limited your alcohol intake, now you're at 81% lower risk. So really, really impressive. Not only do bad things cause risk, but good things cut your risk dramatically. So with that, let's jump into our discussion of the risk factors. So the first one that I think is often misunderstood is blood pressure. We know that about 46% of U.S. adults have hypertension, and only a fraction of those know they have hypertension or high blood pressure. But what a lot of people don't know is, what is high blood pressure? Well, we know that high blood pressure is the pressure that your blood is pushing out on the walls of your arteries with every time your heart beats and relaxes, right? When your heart beats, the pressure goes up, and it should be less than 120 over less than 80. A number above 130 over or above 80 means that you have high blood pressure, right? So when you have high blood pressure, then when your heart contracts, it's pushing out on the walls of the artery, but it's supposed to relax when the heart isn't pumping, and that lower number is the pressure that your arteries are seeing when your heart is fully relaxed. And so for people who have that lower number elevated, that's a problem because that means your arteries are never getting a break, right? So both numbers are important. You want them to ideally be less than 120 over less than 80. So like a number of 110 over 70, perfect. That sounds great. And you don't need to see everything on this slide, but what we do want to see is that hypertension is the most potent lifestyle risk factor we know of, and it's drastically undertreated. The red lines here are people with high blood pressure over time between age 35 to 95. And we see that the red lines rise faster, meaning that people develop these diseases who have high blood pressure much more commonly than those who don't have high blood pressure, which includes angina, it means chest pain, myocardial infarction or heart attack, unheralded cardiac death, heart failure, sudden cardiac arrest, transient ischemic attack, ischemic stroke, head bleed, subarachnoid hemorrhage, intracerebral hemorrhage, peripheral arterial disease where there isn't enough blood flow to your legs and limbs, and abdominal aortic aneurysm. So high blood pressure is a risk factor for all of these things over the course of a lifetime from 35 to 95. And we know that that risk begins to shoot up. We didn't make up this number 120 over 80 arbitrarily. When you look at the data, you see that the risk begins to increase at 120, and really that begins to increase above 130 is when we call it high blood pressure, because the risks of things like coronary heart disease, like a heart attack, cardiovascular events, stroke, all begin to increase at that level. And once you start getting above 150 or 160, your risk of all-cause death starts going up. Same thing happens with diastolic blood pressures. Above 70, that's when we start seeing a little bit of an increase, but above 80, that's where that increase gets more significant, right? To the point where when your lower number in your blood pressure is above 100, you have a 2 times risk of having a heart attack or a stroke. So what affects our blood pressure? Well, there's a lot we can do in our lifestyle to lower our blood pressure. Certainly, we can't lower our age, although we might wish to. But physical activity is one of the best ways we can lower blood pressure. Regular physical activity lowers blood pressure over time. The other thing in diet is really limiting our salts. You can even substitute sodium salts for potassium salts, and these are things that you could get in the grocery store. So You can see like no sodium salts or potassium salts. You can find them in your salt aisle. Blood vessel health is extremely important. So anything that helps you with your blood vessel health, that's healthy diet, that's exercise, that's losing weight, that's improving your blood glucose numbers. That's all of these things can help with your blood vessel health, as we talked about, that endothelial health that we talked a few slides ago. Lowering your weight, decreasing alcohol intake is actually one that people, I think, don't clock as something that's attached to blood pressure, but it certainly is. Decreasing your alcohol intake. Smoking is an important, it really constricts your blood vessels and causes that pressure to jump up higher. Kidney disease is another. Kidney disease is very interesting in that we probably underdiagnose it. It's very linked to heart disease. It's probably that, the kidney is a potent regulator of our blood pressure. So when we think about kidney disease, it's all the same principles that we've already been talking about, maintaining a healthy body and a healthy lifestyle. The metabolic syndrome and genetics certainly also play a role. You can't alter your genetics just yet, maybe on the way, but the metabolic syndrome is when you have, that central adiposity, that extra tire of fat around the midsection, the abdomen. You have high blood pressure, you have bad cholesterol. All those things together start really impacting our blood pressure. So, physical activity. 1 in 5 adults, or only 22% of American adults, reported achieving adequate leisure time aerobic and muscle strengthening activities to meet physical activity guidelines based on 2016 data. So 1 in 5 is a pretty dismal number for probably the most potent thing we have to prevent all disease, which is exercise. Physical inactivity, so that's for adequate exercise, right? That's for getting your leisure time exercise and muscle strengthening exercises in. But physical inactivity is actually also a shared risk factor. So in this study here, we found that the risk of having heart disease if you were physically inactive, meaning sitting around all the time, was easily 33% higher. But it was also a 63% higher risk for diabetes, a 34% higher risk for breast cancer, a 38% higher risk for colon cancer, and a 47% higher risk of dying. And so we know that it's not just getting adequate physical activity, but it's also avoiding the sedentary behavior, which is really important. And this is a slide kind of showing from the prestigious scientific publication Nature that tried to summarize how many ways physical activity tends to benefit us. And it's way too many. We have another slide here on like all these different pathways, but it's way too many to really adequately quantify. But really, it goes into this improved vascular endothelial health, helping with our nervous system, vascular remodeling, meaning that even if there's a blockage in one of our arteries, our exercise can train our body to actually grow new arteries around that, which is amazing. And something called cardiac preconditioning, which tells us that even if you were to have a heart attack, exercising teaches your body how to deal with stresses and actually can limit the size of the damage that happens to your heart. It's really amazing. But regular exercise is really the key. Just exercising once and then saying, hey, am I healthy yet, is probably not going to do it. And why is that the case? Because it truly is, I feel like exercise should really be termed training, right? You're actually training your body how to be healthier. You're teaching it, right? And just like you would teach a child, you wouldn't, give them a page of the multiplication tables and tell them, cool, now you know multiplication. They have to practice it. They have to train. They have to learn how to do it. And so the same thing is true. When you start exercising, you're training your muscle cells, yes, but you're also training all your other inflammatory cells, your immune cells, how to respond to stress. And so they actually saw this. They saw, they did this in mice and they said, hey, listen, what we're going to measure is we're going to measure the stress response in this mouse and the performance after exercise. When they first started exercising these mice, the performance dropped low and the stress went high, meaning that the mice, their bodies experienced extreme stress. So somebody who hasn't exercised in a long time and exercised for the first time in a while, they might get very sore, right? That's a expression of stress, right, on your body. Not necessarily a bad thing, especially if you've trained your body to understand stress. But the first time it might feel pretty bad and you might want to give up. But look at what happens if you keep going. Every time these mice exercised, the performance dipped, but less. the stress happened, but less. And as they exercised more, all of a sudden there was almost no performance dip, and the stress response had decreased dramatically. I'll save you the extra details, but this all happened because of a type of T cell in your immune system called T regulatory cells. But really, really impressive that you can train your body to deal with stress better. In fact, this is such an active area of investigation that scientists at Stanford, at the Broad Institute, and others have formed a multi-million-dollar research enterprise to try and understand what are all the millions of different ways that exercise benefits us, and can we replicate any of them? Can we learn how to use them? If someone, say, for instance, is unable to exercise, maybe they have lost the use of their limbs, or maybe they have a horrible neurodegenerative disorder, or they have cancer. How do we help them get the benefits of exercise, even if they can't exercise, right? So really, really incredible work going on. Now, one of the things that I hear a lot from patients, and honestly more commonly family members, is that, I'm too sick, I can't exercise, or I'm too short of breath, I can't exercise, I'm too old, I can't exercise. And guess what? There's data to show that that's not true too. So this is a study looking at, where did people get the most benefit from activity? And what they saw was going from 0 to 5 med hours per week. So just beginning to exercise, just stepping out the door once a day. Goodness, that led to the biggest drop in all-cause mortality risk, about 30% drop from going from fully sedentary to doing some sort of exercise. And then after that, the more you exercised, there was a continued decrease until it started to become kind of a plateau. And after basically going from marathoner to ultra marathoner, that's for fun. That's not necessarily for your health, right? But so there's definitely like a diminishing returns. But I think what we should learn from that, and what they did learn from that, was that they looked at who were the ones who benefited the most from physical activity. And it was the people who were the most sedentary, people who were the most limited by shortness of breath, older people who were smokers with diabetes, with peripheral arterial disease, and with bad biomarkers of disease. So what we see here is a pattern that plays out across all of medicine. The people who benefit the most from an intervention are the people at the highest risk. So in the event that any of you here today are attending because you're thinking, gosh, like I really want to start getting healthier, but I just don't know that, doing a little bit, like if I can't do a boot camp class or something, a high intensity interval training class, then I'm not going to get healthier. That's not true. Even the smallest amount of exercise helps you. And what we also see is that even if you do have a heart attack, the people who were engaging previously in exercise have a much smaller area of damage to their heart than people who weren't exercising before. So sometimes I see that and people say, Doc, like, I don't know how this could have happened. I exercise all the time. I take care of myself, and I'm still having this event. And I say, hey, you're here with me. And you're probably going to leave the hospital faster and feel better quicker. And you're probably going to live a longer life. All of that work that you put in, the data shows that actually still makes a difference, even if you land up in the hospital for some reason. All right, moving on to dietary patterns. So dietary patterns are an area of a lot of debate. People are always saying like, "Oh yeah, I don't know what diet helps." Like they're getting confused by social media here. Almost some person says eat eggs, some people says don't eat eggs. Somebody says eat carnivore diet, don't eat carnivore diet. What do we actually do? Well, the data are surprisingly consistent on this. You can look back many, many decades, and most of the studies really lean in the same direction. The biggest study that you'll hear cited is something called PREDIMED. It was a study done in Europe where they tested the Mediterranean diet, a diet rich in lean sort of fruits and vegetables, lean protein, some seafood, nuts, olive oil. And what they found was that they bought food for everybody, and they randomized them to say over 5 years to have the Mediterranean diet or the regular diet, right? And they gave them like some healthy diet index cards, and they told them, hey, you should eat healthy. It wasn't people who were just eating terrible food all the time. And what they found was that from day one of the study, the risk of heart attack, stroke, or death from cardiovascular causes immediately was lower. Day one of the study, it was lower for individuals who were on the Mediterranean diet, and not by a small amount. They were able to cut the risk of heart disease just by doing this one thing. And we know that it was because of this, because it's a randomized controlled trial. They were able to cut the risk of heart attack, stroke, or death from cardiovascular causes by 30%, 31%. Really, really impressive. So we know that extra virgin olive oil, diet rich in nuts, plants, fruits and vegetables, and lean protein, we know that that helps, right? But most things in dietary science are not randomized control trials. We can see, however, even going back, this is going back as far as 1991, they took a group of Tarahumara Indians, and it's a Mexican, like a tribal people, and they brought them in, and they said, you know what happens if we have people who are on a tribal diet start eating traditional American food? So they brought in 13 Tarahumara Indians, and after 5 weeks of consuming the affluent diet, their plasma cholesterol level increased 31% from 121, which is around what we said the average should be, to 160, right? This is just in 5 weeks, right? LDL went up 39%, the HDL went up 31%, the triglycerides went up 18%, and in 5 weeks, all subjects gained about 3.8 kilograms, or 7% of their body weight. This is what this looked like. The cholesterol went up in all 13. The plasma cholesterol went up. The LDL went up. The HDL went up a little bit. The triglycerides went up, and the body weight went up. So we know that these studies really work. Additionally, this was another study also done around, this is 1981, where they took in 21 strict vegetarians, and they took them from their usual vegetarian diet to 4 weeks of beef added into the diet. And this was isocalorically added, so there was no increase in calories. And what they found was that their total cholesterol went up by 20%, their systolic blood pressure went up by 3%. This was just in 4 weeks, right? And their plasma renin levels, prostaglandin A and E levels, their urine kallikrein, their norepinephrine, their epinephrine excretions, everything had changed, right? But that doesn't mean that you can just eat plant-based junk food. This is a study looking at the plant-based dietary index and the risk for coronary heart disease. And they found that when people were eating a more plant-based diet, that means that their PDI, their plant-based dietary index score was higher, their risk of heart disease was lower. And if they were eating healthful plant-based diet, then their risk really began to go down. But if they were eating an unhealthy plant-based diet, what does that mean? Well, Oreos are plant-based, right? Cheetos are plant-based, right? McDonald's is often plant-based, right? But if you eat an unhealthy plant-based diet, yikes, look at your risk of disease. It goes up, 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 right? Same thing is true here, right? Where if you eat a bunch of animal foods in servings per day, the more you eat, your risk for coronary heart disease is going up. But if you're eating less healthy plant foods, that does the same thing. In fact, in this study, worse, right? So healthy plant foods are the best thing to lower your risk of coronary heart disease, and a healthy animal food-based diet is also possible with fish and chicken and lean meats. But you got to plan it so your diet is really plant forward. So when I counsel patients on diet, I don't tell everybody that they have to be vegetarian. I don't tell everyone that they have to be vegan, but I do say add in some of the healthy stuff, right? The first thing that we really in our modern diet really don't get is fiber, right? So if you're eating plant-forward foods like sweet potatoes loaded with fiber, you might have, like berries are loaded with fiber, right? These low-calorie, high-fiber, high-water content vegetables. You can Google what those are, or you can take a look at some of the articles that I've written on the MGH website. Fruits and berries are incredible. They're highly antioxidant rich. They're low calorie. They're high in fibers. Look at those bright colors. Those are lots of antioxidants. And then protein. Add in lean protein. Like I always tell my patients, hey, listen, I get it. Maybe you didn't grow up eating these things, but you should try tofu, tempeh, seitan, beans. Try these things. And then if you don't like them, add the fish, add the chicken, add the other lean proteins. That's fine. So we've talked about blood pressure, we've talked about diet, we've talked about exercise, right? I think a couple of things that we'll just continue to mention is that, the cardiovascular diseases develop across the whole lifespan. This includes your genetics, the risk that you inherit in this world, some ambient exposures like pollution, poverty, inequality, right? But then lifestyle and medical comorbidities are really the things that we think about a lot. And then patient behavior, but also prescriber behavior. Did we start preventive medications early enough? Well, if we wanted to think about genetics and how that intersects with our lifestyle, that would be really interesting, wouldn't it? Because a lot of us think about genetics and we say, like everybody in my family has heart disease. Is changing my lifestyle really going to make a difference? Right? And absolutely it will. Okay. The reason why I can say that is because we have data in this arena. Okay. So this is a study that our group did back in 2016, and it binned people into low genetic risk, intermediate genetic risk, or high genetic risk. Right? Now, people at high genetic risk have multiple times, 3, 4, 5 times the risk of heart disease compared to people at low genetic risk. But then they looked at how many people actually had heart attacks. And when they separated them by a favorable lifestyle, an intermediate lifestyle, or an unfavorable lifestyle, they saw that across all genetic risk categories, the bad lifestyle people had more risk than the good lifestyle people in blue. But what was super interesting was that the difference in the low genetic risk category was not that much, but the difference in the high genetic risk category was tremendous. Now excuse me, we understand this intuitively because we know we all have an Uncle Larry who, you know, he smoked all his life, never developed lung cancer, whereas, our friend Ben smoked 2 cigarettes and developed lung cancer at the age of 30. We've all heard these stories, right? So what's the difference between those two? Well, turns out that if you happen to have won the genetic lottery and your risk is low, you can behave pretty badly and your risk still stays pretty low. But if you're at higher genetic risk, average or higher, your risk is really dependent on your lifestyle, right? And this is an amazing piece of this that you can drop your risk from super high if you have a bad lifestyle to actually similar to people at low genetic risk if you live a healthy lifestyle. That is the important message here. And that's that, you know, if you have high genetic risk, if everybody in your family has developed disease and all that kind of stuff, all that means is that you have to hold yourself to a high standard of your own healthy lifestyle. I know it's hard work. I know that it's not easy all the time. But when you do have that healthy lifestyle, those people have the greatest benefit in lowering their risk of future heart disease. So it stated another way, if someone came to me and said, "Hey, listen, doc, everybody in my family's got heart disease. It's my fate. There's nothing I can do." I'd say, actually, the exact opposite is true. Because everyone in your family has heart disease and you think your genetic risk might be high, that's exactly why everything's in your power. Right? That's the important message. So lifestyle is incredibly important in high risk individuals. Another thing that we think about a lot is people say to me, "Hey, listen, doc, all this lifestyle stuff might be good, but I've already started developing disease. Can I reverse it? Is there anything I can do to fix it?" And I say, well, good for you. Uh, that we already have a little bit of that answer. I never tell a patient that they can definitely reverse their heart disease, but I do tell them that they have a shot. And the reason why I never tell them like, yes, we can reverse your heart disease is because changing lifestyle is hard. And while we have great medications, they have to be partnered with great lifestyle change in order to show the most effect. So let me tell you a story. This is a story that was published. I'm not sharing any personal information here, but this is a story of a 42-year-old gentleman um, who presented to the Brigham and Women's Hospital years ago. And he was having some chest discomfort every time he would walk up this hill. He'd go for his daily walk with his dog. And he would have some chest discomfort, and he would rest at this bench on the side of the road, and he would feel better, and he would walk back home. And his wife said to him, "Hey, listen, I think you should probably go see the doctor." He came into the emergency room actually because this was getting worse and worse, and they ordered a stress test and they ordered a CT scan. Now, many of you may not have looked at a stress test before, but I'll walk you through here. And what they showed here, this is showing with nuclear radio tracer, they're showing that blood is getting to all parts of the heart here in a nice, beautiful circle when he's resting. But when he starts exercising, it begins to increase normally. But then there's this little area of the heart that doesn't seem to be getting very much radio tracer. Uh-oh, that could be a blockage. So they get a CT scan and they look at his heart arteries and they see, yes, there's calcium flex, but this artery here going to the same area that the stress test showed wasn't getting enough blood flow is all gunked up with all this dark gray stuff. That's all cholesterol plaque deposits in his artery. Oh boy, that doesn't sound good, does it? Well, friend of mine, Dr. Ron Blankstein, he treated this patient, so I know a lot about this patient. And he said, "Hey, listen, we're going to start you on an aspirin. We're going to start you on a atorvastatin. We're going to start you on a ezetimibe. We're going to get you on a beta blocker. But you also got to change the lifestyle. We got to." So I know the treating physician, so I know that this patient took this very seriously. He started a plant forward diet. He started taking his pills every day. He started exercising regularly. He lost a bunch of weight. He did all this stuff. And then his chest pain over the next few weeks began to disappear. It wasn't until 4 years later that he started having some heartburn in his chest. It was a burning sensation, not like the previous chest pain. But he knew that he had coronary artery disease, so he was a little worried. He went back into the emergency room. And in the emergency room, they did another stress test. And if you'll remember, this was the stress test from 4 years ago, where he had that area of the heart that wasn't getting any blood flow. Well, look at this. On rest, his heart was getting nice blood flow everywhere. But at stress, that area that used to not have blood flow suddenly was getting it again. They did another CT to look at his heart arteries. And you remember this artery, the left circumflex, used to be all gunked up with cholesterol plaque. Holy moly, it's fully open, and contrast is beautifully flowing through both arteries now. In fact, both arteries look like they're twice the size of what they used to be. That's amazing. So atherosclerosis can be reversed through a combination of lifestyle and medication, and some people just lifestyle itself. So this is an incredibly important tool set. We have lots of data in this area, and despite what you might hear online and all that kind of stuff, there's lots of really good data showing us the pathway to get healthier and all of that. So with that, I think those were the last slides that I had. And I'd love to open it up to any questions that anyone has. Please just type them in the chat, and I'll spend a few minutes answering some questions. I do see here that,
Yeah.
yep, go ahead, Luz.
Yes, I was just going to mention that we did had a topic proposal in the chat. Someone had asked if you could, if they were interested in learning more about the recent altruistation recall.
Recalls and stuff like that, I don't think are the topic of this conversation. It's more about lifestyle. I'm not really familiar with the details of a recent recall. Any other questions? All right, fantastic. If we have no questions, let's see. Does
Oh, yeah.
exercise count even if you do not raise the heart rate? Absolutely. So it's unusual that someone's heart rate won't move if they start moving. But there can be reasons for that. Some people have pacemakers. Some people may have medications that they're on. But exercise helps no matter what. No matter what. Raising the heart rate is, of course, very good for us. But if you happen to be in one of those camps where you have a pacemaker or you have a medication that blocks your heart rate from going up, we know that exercise, cardiovascular exercise, and muscle strengthening exercise, they both improve health regardless of whether the heart rate is being raised. I see that there's a follow-up being typed, so I'll give it a minute. Would eating avocado oil with ice cream, etc., carry out or counteract bad cholesterol? Absolutely not. No. So the eating a polyunsaturated fatty acid with saturated fatty acids does not help you carry out any of the cholesterol or anything like that. What might help combat eating high cholesterol or high saturated fat foods is fiber. So we know that the reason why, like for instance, beans are neutral in terms of their effect on people's blood sugar, or why eating a high fiber food before you have a fatty meal it doesn't increase your cholesterol as much. It's because the fiber binds the glucose and the fat, and it actually often will carry it out in the stool before it gets a chance to be absorbed, or it will cause it to be absorbed much more slowly, which can help your body deal with it. Maximum cholesterol daily. I wouldn't say that there's a specific maximum cholesterol daily. We've really moved away from monitoring the specific cholesterol intake. I would say per serving, your saturated fat should really be under 2 grams of saturated fat per serving of food. Um, are there any significant differences between men and women in these tests? I presume you're talking about the stress test and the CT scan. Um, Not really. Stress tests can be a little bit less accurate in women, just because of the breast tissue. But we now have newer types of stress tests that can actually eliminate many of those side effects, and in fact can actually better detect disease in women than before. Are there any per day max? I'm not sure how to guide you here. I'm not sure what the question is really. Um, okay. Other questions? Uh,
Um,
Cholesterol limit daily. I would really follow your blood cholesterol levels. And actually, if you're interested, I'll drop a link in the chat to the sort of the best and worst foods for high cholesterol that there's a sort of a more detailed article that MGH has interviewed me for, and you can take a look at that there. There you go. All right.
I do see we have a question here. It asks, what is cholesterol level should be shooting for? I missed the beginning with trouble signing on.
I see. I see. Thanks. What I meant was at what level should we take meds? That's a very nuanced question. It depends on your age. It depends upon your other risk factors. It depends on what you've tried already. Some people I know, like they have a genetic problem processing cholesterol. They're already eating super healthy, but their cholesterol is super high. And in those people, we start medications very early in life. Whereas other people, they have very few risk factors and their cholesterol is just a little bit high, and we don't start cholesterol meds. And lastly, this is really a risk-benefit discussion with your doctor, where they have to evaluate your overall global risk, and then you guys have to come to a decision together. Some people are more aggressive in their prevention approach, and they prefer to lower their risk at an earlier stage, whereas other people are use an approach where they say, well, let me just see if anything goes wrong, and then I can decide if I want to start medications. So, in general, I think we start cholesterol medications too late for most people who are at risk, but there's also a lot of people who we start cholesterol medications in who don't need them. So I think that needs to be a very personal decision with your doctor. All right.
We did have someone ask if the slides would be available. I will drop a link in the chat. The meeting today is being recorded, so you will find the recording after 2 to 3 weeks.
Fantastic.
Dropping the link.
All right, everybody. With that, I think we'll conclude for the night. But thank you so much for attending, and I hope you found this interesting and helpful.
Yeah, thank you for your presentation today.
Fantastic. Thank you very much, everybody. Take care.